Hello, my name is Patricia Hernandez, and this is the presentation about the reading and exercises from chapters 1 to 4. Here we go. Okay, this is the first unit. It is health and illness. Asking about health. Health is the state of the body. When doctors want to know about a patient's usual health, they ask questions such as, what is your general health like? How's your health generally? If you are in good health, you are well and have no illness or disease. If you are healthy, you are normally well and can resist illness. If you are fit, you are well and strong. En salud y enfermedad. Preguntando sobre salud. La salud es el estado del cuerpo. Cuando los doctores quieren saber sobre el estado usual de un paciente, ellos hacen preguntas como, ¿cómo es tu salud? ¿Cómo es tu salud general? ¿Cómo está tu salud en general? ¿Cómo es tu salud generalmente? Si si tienes una buena salud, tú estás bien y no tienes una enfermedad, Si tú estás saludable, estás normalmente bien y puedes resistir a enfermedades. Si tú estás en forma, estás bien y fuerte. Ok, not ill, healthy, fit, in good health, well, very well, fit and well. And ill, when you are ill, you are unhealthy, unfit, unwell, in poor health, poorly, and not well, and not very well. Ok. No enfermo, cuando no estás enfermo, estás saludable, estás en forma, estás en buena salud, estás bien, muy bien, o estás fuerte y bien. Y cuando estás enfermo, no estás saludable, no estás en forma, no estás bien, tienes una salud pobre, pobremente, no bien y no muy bien. Sickness. Sickness has a similar meaning to illness. It is also used in the names of a few specific diseases, for example, sleeping sickness and travel sickness. Patients also talk about sickness when they mean nausea and vomiting. Patient says, I was sick this morning. Possible meanings are, I was ill this morning. I felt unwell this morning, or I vomited this morning. Patient says, I feel sick. Possible meanings. I feel ill. I feel unwell. I am nauseous. And I feel the need to vomit. En enfermedad. Enfermedad tiene un significado similar a illness, enfermedad. También es usado en el nombre de ciertas enfermedades específicas, por ejemplo, enfermedad del sueño o enfermedad del viajero o de viajar. Los pacientes también hablan de enfermedad cuando se refieren a náusea y vómito. El paciente dice, yo estaba enfermo esta mañana. Puede significar, yo estaba enfermo esta mañana, me sentía mal esta mañana o yo vomité esta mañana. El paciente dice, me siento enfermo. Un posible significado podría ser, I feel ill, me siento enfermo, me siento mal, me siento con náuseas o siento la necesidad de vomitar, siento que quiero vomitar. Okay. The combination sickness and diarrhea means vomiting and diarrhea. La combinación enfermedad o enfermo y diarrea significan vomitar y diarrea. Recovery. When patients return to normal health after illness, they have recovered. We can also say the patient made a full recovery. The patient made a good recovery or the patient made a complete recovery. Cuando los pacientes regresan a un estado normal o regresan a salud normal después de una enfermedad, ellos se han recuperado. También podemos decir, el paciente hizo una buena recuperación, el paciente hizo una recuperación completa o el paciente hizo una completa recuperación. If a patient's health is in the process of returning to normal, the patient is improving. The opposite is deteriorating. We can also say that the patient's condition improved or deteriorated. Si la salud de un paciente está en el proceso de volver a lo normal o a la normalidad, el paciente está mejorando. Lo contrario sería deteriorando. También podemos decir que la condición del paciente ha mejorado o ha deteriorado, o mejoró o deterioró. Cuando hablamos, usualmente usamos el verbo get para hablar de cambio. In speech, we often use the verb get to talk about change. Get over an illness, it is to recover. Get better means to improve, and get worse means to deteriorate. Get over, de salir de una enfermedad, significa recuperarse. Get better o mejorar significa improve, mejorar. Y volverse peor o empeorar significa deteriorar. And if a patient is better but then gets worse again, the patient has relapsed. Another word for improvement, especially in recurring conditions such as cancer, is remission. He got over the illness very quickly. 2 years later, she remains in complete remission. Entonces, si un paciente está mejor, pero luego vuelve a estar peor de nuevo o vuelve a empeorar de nuevo, el paciente ha recaído. Otra palabra para mejorar o mejoramiento, especialmente cuando recurrimos a condiciones como el cáncer, podemos decir remisión. Él se recuperó de la enfermedad muy rápido. O 2 años después, ella cayó en completa remisión. Okay, now the exercise from this unit. Okay, 1.1. Complete the table with words from A and B opposite. The first one has been done for you. Okay, fitness, the noun, and fitness, health, illness, and sickness. Fitness, fit, health, healthy, illness, ill, sickness, sick. The other one, make word combinations using a word from each box. Look at V and see opposite to help you. Okay, complete remission, feel sick, get over, poor health, travel sickness. Complete the conversation, look at V opposite to help you. Okay, this is a conversation. Doctor and patient. The doctor says, how are you feeling today? Not very well. How long have you been feeling unwell? About a week, says the patient. The doctor asks again, what is your health like normally? Very good, and usually quite fit and healthy. The doctor asks again, what is the problem now? It's my stomach. Do you feel sick? Yes. Have you actually been vomiting? No. Have you had any serious illnesses in the past? No, not at all. Okay, the other exercise is choose the correct word to complete each sentence. Look at V and see opposite to help you. Her condition deteriorated and she died. He recovered and was allowed to go home from hospital. The cause of sleeping sickness was discovered in 1901. Number 4 is the patient made a full recovery. Number 5, I have been in good health for months and feel very fit. Number 6, it was a month before I got over the illness. And the last one, number 7, he seems to be rather unhealthy. His diet is bad and he never exercises. Okay, over to you. What advice do you give people for keeping fit and well? Okay, my advices are to sleep well at least from 6 to 8 hours or 9 hours every day. Eat healthy fruits, vegetables, and exercise often, at least 3 to 4 times in a week. It can be for 30 minutes or more. Control your stress and control your emotions. Okay, this is, okay, we finished with the first chapter. Okay, the chapter number 2. Parts of the body, number 1. Okay, parts of the body. Most external parts of the body have ordinary English names as well as anatomical names. Doctors normally use the English names even when talking to each other. There are a few exceptions where doctors use the anatomical name. These are shown in brackets below. Okay, partes del cuerpo 1. Partes del cuerpo. La mayoría de las partes externas del cuerpo tienen nombres ordinarios en inglés, nombres comunes ordinarios, como también nombres anatómicos. Los doctores normalmente usan los nombres en inglés, incluso cuando están hablando entre ellos. Hay algunas excepciones cuando los doctores usan nombres anatómicos, esos son mostrados más abajo. Okay, this is a body and this is the parts of it. Okay, number 1 is jaw or mandible. Number 2 is neck. We can see it here, neck. Number 3 is shoulder. Number 4, armpit or axilla. Number 5, upper arm. Number 6 is elbow. Number 7, back. Here, back. And number 8 is buttock. Number 9, wrist. Number 10 is thigh. Number 11, calf. Number 12, leg. And 13 is chest or thorax. Number 14 is breast. And 15, stomach, tummy, or abdomen. Number 16 is navel or umbilicus. Number 17, hip. 18, groin or inguinal region. 19 is knee or patella, that is the same as kneecap. And 20 is shin. Entonces, traducimos. La primera es mandíbula, el segundo es cuello, el tercero es hombro, el cuarto es axila, el 5 upper arm, antebrazo, parte de arriba del brazo, el 6 es codo, el 7 espalda, 8 glúteos, 9 muñeca, el 10 es muslo, el 11 es pantorrilla, el 12 es pierna, el 13 es pecho o tórax, el 14 es pecho, mama, puede ser, pechuga, ajá, mama. El 15 es estómago, también conocido como tummy, o abdomen. El 16 es ombligo, 17 cadera, el 18 región inguinal, 19 rodilla o patela, y el 20 es chin. Ok. Let me see something. Ok, lo que se conoce como espinilla sería chin. Okay, limb means arm, upper limb, or leg, lower limb. The trunk is the body, excluding the head and limbs. For a more detailed diagram showing parts of the body, see Appendix 1 on page, okay. En extremidades significan los brazos, esas son las extremidades superiores, o las piernas, que son las extremidades inferiores. El tronco es el cuerpo, excluyendo la cabeza y las extremidades. Okay, V, referring to parts of the body. When patients speak about their problem, they often refer to a part of the body. I'm having trouble with my hip. I'm having trouble with my shoulder. I'm having trouble with my knee. The doctor often needs to ask about a part of the body. Do you get any pain in the chest? Do you get any pain in your stomach? Do you get any pain in the back or in your back? Ok, refiriéndonos a partes del cuerpo. Cuando los pacientes hablan sobre algún problema que tienen, cuando los pacientes hablan de su problema, ellos usualmente se refieren a alguna parte de su cuerpo. Por ejemplo, estoy teniendo problema con mi cadera, estoy teniendo problema con mi hombro o estoy teniendo problema con mi rodilla. El doctor usualmente necesita preguntar sobre alguna parte del cuerpo. Por ejemplo, ¿tú sientes algún dolor en tu pecho? ¿Tú sientes un dolor o tienes algún dolor en tu estómago? ¿Tú tienes algún dolor en tu espalda? Ok, sí. Describing radiation of pain. A patient is telling the doctor about his back pain and the parts of the body it radiates to. Okay, the patient says, it starts in the back. Then it seems to go into the right buttock and down the back of the right side to the knee. Ok. Describiendo la radiación o la transmisión del dolor. Un paciente le está diciendo al doctor acerca de su dolor de espalda y las partes del cuerpo a la que se irradia o a la que se va el dolor. Dice, empieza en la espalda, después parece ir hacia el glúteo derecho y hacia abajo de la espalda o bajo la espalda, al muslo derecho, a la rodilla. Okay, the exercises of the chapter 2 are 2.1. I have my book here. Okay, 2.1 is write the ordinary English words for the corresponding anatomical terms in the table using your medical knowledge. Look at A, opposite to help you. Anatomical term, abdomen. Common name, stomach or tummy. Axilla, armpit. Carpus, breast. Coxa, hip. Cubitus, elbow. Mama, breast. Nates, buttocks, and patella is knee or kneecap. 2.2. Complete the sentences using ordinary English words. Look at A and see opposite to help you. Okay, A. A male patient describing angina pectoris. It's like a tightness across my chest and it goes up into my neck and into my left shoulder and down the left arm. B. A male patient describing renal colic. It starts in the loin and goes into the groin and down into the testicle. 2.3. Complete the sentences. Look at A opposite to help you. Anatomical term and patient statement. Okay. I've got a lump in the groin. Okay, let me read this. Anatomical term, inguinal swelling, abdominal pain, periumbilical rash, thoracic pain, enlarged axillary node, and mandibular pain. Patient statement. I've got a lump in the groin. My little boy's got a stomachache. I've got some spot around my navel. I've got a pain in the middle of the chest. There's a painful swelling in my armpit. And I've got a pain in my jaw. Okay, 2.4 is complete the table with words from the box. The first one has been done for you. Okay. In the trunk, we have the abdomen, the chest, and the loin. In the upper limb, we have the elbow, arm, wrist, and fingers. And in the lower limb, we have the knee, leg, and side. Okay, over to you. Make a list of the word from A opposite that you find hard to remember. I think I know all of them, or I have learned all of them. Okay. You already see that? So that. Okay, the chapter 3 is parts of the body 2. A, the abdomen. The main organs of the body have ordinary names, have ordinary English names, and doctors use these words. But when an adjective is needed, they often use an anatomical word. For example, we can say disease of the liver or hepatic disease. Some abdominal organs, for example, the pancreas, have no ordinary name. Ok. Partes del cuerpo, número 2. El abdomen. Los principales órganos del cuerpo tienen nombres ordinarios o comunes en inglés y los doctores usan estas palabras. Pero cuando un adjetivo se necesita o es necesitado, ellos usualmente usan palabras anatómicas. Por ejemplo, podemos decir enfermedad del hígado o enfermedad hepática. Algunos órganos abdominales, por ejemplo, el páncreas, no tienen nombres ordinarios. Ok. Pancreas, stomach, spleen, left kidney, right kidney, liver, gallbladder, and duodenum. Ok. Páncreas, estómago, el vaso, riñón izquierdo, riñón derecho, hígado, vesícula biliar y duodeno, que es la primera porción del intestino delgado. Okay, when doctors talk about the main parts of the digestive system, they use the words bowel or intestine. The small intestine or the small bowel, the large intestine or the large bowel. When speaking to patients, doctors may refer to the anus and rectum as the back passage. Cuando los doctores hablan de las principales partes del sistema digestivo, ellos utilizan palabras como intestino, el intestino delgado, que para ellos es pequeño, small, o the small bowel, el intestino delgado, el intestino grueso, que para ellos es large, o el intestino largo. Cuando ellos hablan con los pacientes o a los pacientes, los doctores se refieren al ano y al recto como el pasaje trasero. Okay, B, the chest. The chest or thorax contains the organs of respiration and the heart. The main parts of the respiratory system are the airways and the lungs. The left lung is divided into 2 lobes and the right into 3 lobes. The airways consist of the larynx, the trachea or windpipe, the right and left bronchus, and the bronchioles. The chest is separated from the abdomen by the diaphragm. Okay, the right and the left bronchi. Okay, el pecho o tórax. Contiene los órganos del sistema respiratorio y el corazón. Las principales partes del sistema respiratorio son las vías aéreas y los pulmones. El pulmón izquierdo está dividido en 2 lóbulos y el derecho en 3. Las vías respiratorios consisten en la laringe, la tráquea y los bronquios izquierdo y derecho. Y además los bronquiolos. El pecho está separado del abdomen por el diafragma. C, the pelvis. A doctor is explaining the function of the bladder to a patient. The bladder is situated in the pelvis, as you know, and it is connected to each kidney by a long tube called the ureter, one on each side. The ureters carry the urine from the kidneys to the bladder, where it is stored until you decide to empty your bladder. When that happens, the urine passes down another tube called the urethra to the outside. Ok, la pelvis. Un doctor le está explicando la función de la vejiga a un paciente de la vejiga. La vejiga está situada en la pelvis, como sabes, y está conectada a cada riñón por un tubo largo llamado el uréter, uno en cada lado. Los uréteres llevan la orina desde los riñones hacia la vejiga, donde ésta se almacena, donde es almacenada hasta que tú decides vaciar tu vejiga. Cuando eso pasa, la orina pasa por otro tubo llamado la uretra hacia el exterior. Okay, now the exercise from this chapter. Okay, 3.1. Label the diagram using words from the box. Look at the opposite to help you. The words are diaphragm, lung, lobes, airways, windpipe, bronchioles, and heart. Okay, the number one, as we can see here, is the windpipe, also called as trachea. And the lung, here, the two lungs. Okay, number 3 is lobes. Number 4 is diaphragm. Number 5 is airways. Number 6 is heart. And number 7 is bronchioles. And 3.2, match the conditions from 1 to 8 with the organs affected. A, H, using your medical knowledge. Okay. Let me pronounce the words. Well, the number 1 is hepatitis. It is, the organ that is affected is the liver. Hepatitis, it is an inflammation of the liver. Pneumonia, and the organ affected is the lung. And number 3 is nephritis. The organ affected is the kidney. Number 4, gastric ulcer. The organ affected is the stomach. Number 5, cystitis. The organ affected is the bladder. It is an inflammation of the bladder. Number 6, angina pectoris. It is affected the heart. Number 7, cholecystitis. Here it is affected the gallbladder. And number 8, ulcerative colitis. It is affected the large bowel. Estoy haciendo una tarea, tú me acabas de interrumpir. Dios mío. Complete the textbook extract. Look at A and C opposite to help you. Examination of the abdomen. To examine the patient for enlarged abdominal organs, first feel for the liver and the gallbladder on the right side. To do this, ask the patient to take a deep breath while pressing with the fingers upwards and inwards. Next, feel for the right kidney and then cross over to the other side for the left kidney. Still on the left side, palpate for an enlarged spleen. Finally, moving to the lower abdomen, feel for the bladder, which is only felt if it is full. Okay, over to you. Many patients do not know the location or function of the spleen or the pancreas. How would you explain them to a patient in English? Okay, so the pancreas, it is located inside your abdomen, just behind your stomach, and the functions, it is, okay, the pancreas contains exocrine glands that helps with digestion, and endocrine glands that control blood sugar. And the spleen, it is, okay, the spleen controls the level of white blood cells, red blood cells, and platelets. That's it. Okay, and the last chapter, that is chapter number 4, is functions of the body. Funciones del cuerpo. A, eating. You are hungry, you are in a restaurant, and the waiter brings your food. You smell it stimulates your appetite, you want to eat, your mouth waters, filling with saliva. You take a bite of the food, it tasted good, and you chew it and swallow it. You eat more, but then suddenly you taste something unpleasant. You feel nauseous. You rush to the toilet and get there just in time before vomiting all the food you have eaten. Something has disagreed with you. Ok, funciones del cuerpo, comer o comiendo. Tú tienes hambre, estás en un restaurante y el mesero te trae tu comida. Tú la hueles, estimula tu apetito y tú quieres comer. Tu boca se hace agua, se llena de saliva, llenándose de saliva. Tú le das una mordida a la comida, sabe buena, y tú la masticas y la tragas. Tú comes más, pero luego de repente tú saboreas algo que no te gusta y te sientes con náuseas. Tú corres al inodoro, al baño, y, y tú llegas allá justo a tiempo antes de vomitar toda la comida que te has comido. Eso significa que algo te ha caído mal. Si lo traducimos es algo te ha caído mal. Okay, B, the five senses. In addition to smell and taste, the senses include sight or vision, hearing, and touch, also called sensation or feeling. To ask about the senses, doctors use the questions. What is your sight like? What is your hearing like? Is your sense of smell normal? Is your sense of taste normal? To ask about the sense of touch, doctors talk about numbness, loss of sensation. Have you noticed any numbness in your fingers or toes? Ok, los 5 sentidos. Además de el olfato y el gusto, los sentidos incluyen la vista o visión, oír y tocar, también llamado sensación o tocar. Bueno, para preguntar sobre los sentidos, los doctores usan esas preguntas. ¿Cómo está tu vista? ¿O cómo es tu vista? ¿Cómo está tu oído? Okay, let me look for something. Ok, ajá. ¿Cómo es o cómo está tu audición? ¿Es tu sentido del olfato normal o está tu sentido del gusto normal? Para preguntar sobre el sentido del tacto, los doctores hacen preguntas sobre numbness, sensibilidad, falta de sensación o sensibilidad. ¿Tú has sentido alguna falta de sensación o insensibilidad en tus dedos de las manos o de los pies? Sí. Other functions. function, verb, and noun. Speaking, the verb is speak and speech. Walking, walk and gait. Breathing or respiration, inhale, breathe in, take a breath in, and exhale or breathe out. And breathe out also we can say with breathe out, release. And the noun is breath. Urination or micturition. Micturition. It is urinate, micturate, and pass urine or pass water. The noun is urine. Defecation is defecate, pass feces or pass stools. The noun is feces or stools. Menstruation is menstruate, have a period. And the noun is menstrual period or monthly period. When taking a history, doctors can ask, do you have any trouble walking? Do you have any difficulty breathing? Do you have any problems passing urine? Do you have any difficulty or problems with your speech? Do you have any pain when you breathe in? When auscultating a patient's lungs, the doctor tells the patient, take a deep breath in, hold your breath, then breathe out completely. Entonces, sé otras funciones. Función, el habla, el verbo es hablar y el sustantivo es hablar, habla, discurso. La función, caminar, caminando, el verbo es caminar y el noun es gait o paso, el paso, ese es el sustantivo. En la función, breathing, respiración, el verbo es inhalar, respirar hacia adentro o tener un respiro. En exhalar o exhalar y el sustantivo es respirar. En urination, ok. El verbo es orinar, pasar orina o pasar agua, orinar. Y el sustantivo es orina. En defecación es defecar, defecar. El verbo, defecar y pasar las heces. El sustantivo es heces, heces. La menstruación es menstruar o tener el periodo, tener un periodo, y el sustantivo es periodo menstrual o periodo mensual. When taking a history, doctors can ask, do you have any trouble? Okay, I already read that. Okay, cuando toman una historia clínica, los doctores pueden preguntar, ¿tú tienes algún problema caminando? ¿O cuando caminas? ¿Tienes alguna dificultad cuando respiras o al respirar, respirando? ¿Tú tienes algún problema en orinando? ¿Tienes algún problema con tu habla? ¿O tú tienes algún dolor cuando tú respiras o inhalas? Cuando se está auscultando en los pulmones de un paciente, el doctor le dice al paciente, inhala fuerte, mantén tu respiración y luego exhala completamente. D, less common functions. There are some things we do less often. When we are hot, we sweat. When we are nervous, we shake. When we are sad, we cry. Doctors can ask, do you sweat or shake more than usual? Ok, D, funciones menos comunes. Hay algunas cosas que nosotros hacemos menos frecuente. Cuando estamos acalorados, sudamos. Cuando estamos nerviosos, temblamos. Y cuando estamos tristes, lloramos. Los doctores pueden preguntar, ¿tú sudas más de lo normal, más de lo usual? ¿Tú tiemblas más de lo usual? Okay, now the exercise is 4.1. Match the symptoms to the questions using your medical knowledge. And number 1 is dysuria. Number 2 is dysphagia. Number 3 is diplopia. Number 4 is dysphagia. And number 5, dyspnea. Okay, dysuria is, do you have any pain when you pass water? That's dysuria. Okay, what is your breathing like? That is dyspnea. And do you have any difficulty with your speech? And if you have, it is dysphagia. And do you have any trouble swallowing? That's dysphagia. And is your vision normal? That's diplopia. Number 4.2. Patients are describing symptoms of the conditions shown in brackets. Complete the sentences. Look at C and D opposite to help you. Number 1. I've got pain and numbness in both feet. Peripheral neuropathy. Number 2. I'm having difficulty swallowing solid food. That's esophageal stricture. Number 3, I have a lot of problems passing urine. That's prostatic hypertrophy. Number 4, I've been sweating more than usual, even when it's not hot. That's hyperthyroidism. Number 5, I've noticed that my hands shake when I'm not using them. That's Parkinson. And number 6, I have trouble breathing when I climb the stairs. And that's left heart failure. Okay, 4.3 is complete the sentences. Look at A, V, C, and D opposite to help you. Number 1, when I eat solid food, I have to chew it. I have to chew it for a long time before I can swallow it. Number 2, do you have any pain when you pass stools? Number 3, I have no appetite and I have lost 5 kilos in the last few weeks. Number 4, when did you last have a period? Number 5, the garden is full of flowers, but my sense of smell has disappeared and I can't enjoy the perfume. And number 6 is take a deep breath in. The over to you is you think a patient may have diabetes. Think of questions you can ask the patient to investigate further. Try to use the question types presented in this unit. Okay, the questions I would ask are, do you pass urine more than usual? What is your side like? And do you feel more thirsty than usual? And I think that's it. These were the reading in English and Spanish of the chapters 1 and 4 and the exercises from 1 to 4. So thank you.